Welcome to the Talking HealthTech podcast. My name is Peter Birch. Today on the show, I'm joined by Mark Nevin and Sandra Johnson to talk about the duties of medical workforce to oversee AI in health services. G'day, team. How are we going?
Very well, thanks, Pete.
Very well, thank you.
Mark, it's great to have you on the show again. You're somewhere deep in the depths of the back catalogue of Talking HealthTech, and we'll link up that episode for people to go back and check out. And Sandra, it's great to have you on the show as well. For those unfamiliar, Mark, I know it's been a few times since a bit of time between conversations here on Talking HealthTech. For those unfamiliar, can you introduce yourself? Tell us who you are, what you do.
Sure, thanks, Pete. Hi, everybody. Good morning. I'm Mark Nevin. I'm originally trained as a clinician, then I retrained in economics and specialized in public policy. I've done 25 years in healthcare, last 15 years in executive leadership positions, looking at policy strategy across healthcare, and very passionate about AI.
Amazing. And Dr. Sandra Johnson.
Hello, hi. I'm a paediatrician primarily, but I have also studied law in relation to medicine. And in that role, I've been involved. Well, I was the president of the Australasian College of Legal Medicine for 2 years, and I'm tightly linked in with the American College of Legal Medicine. So what this brings to my thinking is a medical legal perspective, duty of care perspective in relation to my work in all aspects of my work. But I have done general pediatrics and general medicine for many years, and I won't say the number of years, but essentially I have a textbook out there that doctors use in relation to clinical pediatrics. So I like writing. I love writing, so I love sharing my ideas. And my biggest passion at the moment is around artificial intelligence in healthcare. And that's why I'm here.
Yeah, got it. And look, I know even back a while ago, Mark, when we last spoke on the podcast, I'm sure there was themes of AI and its application in healthcare that we discussed then. But as we know, there's been a lot of interest, hype, capability, but also risk, I guess, and things for us to think about. So what brings, maybe if you can set the context a bit more, Mark, what brings you and Sandra together to talk about this topic today?
Well, I guess I've worked in the space around the adoption of new clinical and digital technologies in healthcare over the last 15 years. I started out my policy work in the optometry sector, which was one of those early adopters of electronic health records, and inevitably some clinical governance, human-centered design issues came up. Optometry had quite a few challenges around supply of medical devices, eye contact lenses over the internet, and how the sector would respond to that. Then I moved from there into the radiology and radiation oncology specialties, both of which have been at the forefront of complicated science and technologies in medical practice, both for treatments and use of broader technologies. So one thing that really fascinates me is the interplay of those enablers, so funding, the workforce, the standards, the regulation, the impact new technologies have on things like models of care and care pathways, and then how you're meant to manage those associated changes as a healthcare sector to respond to those. In respect of AI, I was fortunate to be responsible for policy and strategy in the radiology sector when AI really came to the forefront. This is 7-8 years ago plus, and that sector was at the forefront of AI adoption because of the early successes that AI showed around pattern recognition and its ability to recognize images. So around 2017 or so, the radiology sector needed to start to think about its response and started looking at the ethics initially, and that's how I first encountered Sandra, someone else who's passionate about that topic.
Yeah, well, Sandra, you've seen a lot of healthcare too, and you mentioned that there's particular interest in artificial intelligence. Tell me a bit more about where that interest has taken you.
Well, in fact, I'll start it off by saying that in my role as president for the Australasian College of Legal Medicine, I was invited by the American College to present a keynote address at their conference in 2019. So I should just predate before 2019. I was the Royal Australasian College of Physicians representative on the New South Wales Collaborative Network working on digital health records, meaning e-health records. So my work, if you like, Peter, and interest in this field dates back to, I'd say, at least 2016 or so, 2017. But in any case, Mark and I met in 2019 when I was the the college president. And the reason I got into AI is I've always been passionate about technology and how things work, and always asked questions of engineers and so on and so forth. So when the American College suggested, we'd like you to do a keynote address, topic your choice. To be honest, the easiest thing for me to have done would have been to talk about pediatrics, child development, pediatrics. That's my bread and butter. But I thought, no, I'm going to do something hard. So I did artificial intelligence in healthcare, ethics and regulation, the call for regulation back then, 2019, and have a paper produced as a result of that. So the thrill about that was that it kept growing. It kept growing. My interest in the field kept growing, and a secondary paper was written with the Journal of Legal Medicine, that's American, in 2022. So first one written in 2019, second in 2022, and it grew from there. And my involvement with Mark was, as president of our college, he encouraged our college to get involved in looking at the paper that he and the team at RANZA had produced on guidelines for AI use in healthcare. And so our college gave an opinion, didn't we, Mark, to your paper, and that's how our friendship and links started way back then.
Yeah, got you. So a lot of fundamental groundwork there, and well familiar with this space around regulation and use of AI, and particularly in healthcare. But Mark, I'd love to get your current take on it, given you can't go into any conversation about what's next in healthcare or innovation in healthcare without talking about artificial intelligence. And even amongst the clinician community, there's all different types of perspectives. And generally, everyone think about, well, all of the questions that follow on from this. I'd love to get your take, I guess, now in 2025 around what's needed around regulation, or even how you think about regulation and AI in healthcare.
Thanks. That's a great question, a very topical point at the minute. Look, I think regulation needs to be really guided around the fundamentals around risk. So how much risk is there involved in a particular application of AI? We've already got pre-existing regulations, and some of those we've talked about in our paper as well, pre-existing kind of regulations and duties that are applied to that AI context. But looking more broadly around regulation, so a good regulator or policy analyst needs to really think about and understand the context within which they're regulating. What are the other safeguards that are already in place within that sector that you could leverage for this context? You don't need to regulate everything. You should be taking a risk-based approach to regulation. The use of AI in clinical care is internationally recognized as being a high-risk application of AI, because medicine can involve life or death decisions and really life-changing decisions. So you got to start from that, I guess, perspective. And both Sandra and I have written and discussed this a lot around the need for really a holistic approach when you're looking at AI that looks not just at regulation, but you also have to look at the other key system level enablers. So look at things like ethics, look at the type of applications that there will be for AI. What's the role for standards to guide providers around safe adoption? But also more importantly, what's the role of the clinical workforce in respect of that AI adoption? Because when AI is influencing clinical decision making, healthcare is a human-to-human business. It's a clinician-patient relationship that's at the heart of that. The AI might be providing some advice or context or decision support for that clinician. The clinician needs to be capable of understanding the technology, what it's basically recommending in that context, to unpack that then to ascertain whether that's suitable for an individual clinical presentation. So regulation's got a key role around that, but it's one of a range of different enablers.
And I'm thinking, Sandra, when we talk about delivering healthcare, often duty of care is a common kind of central piece to all of that. And again, I'm thinking also artificial intelligence tools, as we've talked about, is not a new thing necessarily within healthcare, or the use of it, but I guess the prevalence of it and how involved it is in the clinical decision-making process is evolving. I'd love to get your take on how that duty of care is evolving with all these new technologies in 2025 in healthcare.
Yeah, good question, Peter. I think the important thing to note is that digital health or digital technologies have been used in medicine for many years, well before we were even talking AI. The thing that's different about artificial intelligence is that we now have these complex neural networks that can learn and reiterate and develop their answers or their predictions very rapidly. I mean, I won't go into a whole talk about artificial intelligence, but the point is the technology is moving fast. And with that in mind, Mark has already alluded to the important points, but the most important point as a doctor is my duty of care to my patient. So if I'm going to be using a technology that I don't understand, or I don't really know how the model was trained, what was the data used in order to feed or develop the model, etc. Those are the sort of things I need to ask myself as a doctor. And then if I'm working within a system such as a hospital, I would like to know that that hospital is taking some responsibility or accountability towards the use of that tool within that clinical setting. So you can see this expands immediately towards the Medical Defense Organization, which is also looking very closely at the use of AI tools in medicine. And at this point in time, at this juncture in history, we're still thinking of AI devices as tools that we are using alongside our clinical practice as assistants to help us with our work. But I don't really want to project too far into the future, but I would like to say that will change, because we will develop systems that will learn faster than we've actually predicted. So I'm throwing that in at the side. We won't go down that path just yet, but most important to say is that our TGA, our Therapeutic Goods Administration, are working diligently on making sure that AI devices are regulated and that they fulfill criteria for safety, because obviously safety, reliability is key when you're dealing with patients. So as a doctor, stay informed, keep being educated, keep learning, and remember, you're always wanting to do something that does the least harm. No harm to the patient, that is.
I'm definitely a fan of a rabbit hole, so we can go down one if we need to. But just, as you were talking, Sandra, and the bringing up the point around tools in healthcare and the need for a clinician to have a real comprehensive understanding of what it's doing, how it was trained, and all of this. I think about, I jump in the car and I don't necessarily need to know exactly how the engine kind of is powered by the blah, 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 because I press the button, it turns on. And even from a clinician's point of view, I don't necessarily need to know how the stethoscope, gives me the inputs I need. I know what information I need from that particular tool, so then I can make an informed decision. But so I guess it makes me think, Mark, we say AI in healthcare, it's everything from full diagnostic stuff down to, being able to crunch a lot of coding to be able to do the billing and the admin side. So I feel like we need a bit of nuance here.
Look, certainly do. So again, I'd written about this before Sandra and I came together on the piece. So there's a really important role for the health workforce in this. Yes, you don't need to know all of the ins and outs for exactly how the technology works, but you need to be something which we frame basically as a competent user of the technology. So you understand generally how the technology works. You understand its shortcomings. So when you're driving a vehicle, just to use that analogy, you understand how the brakes work, the accelerator, how you're supposed to reverse. You're trained to do all of those fundamentals, and then you have to pass a competence test basically before you're given your license to be let loose on the road on your own as a driver. So it's important that a clinician using AI is a competent user of that, so understands the fundamentals of how it works and the parts that they're responsible for. Healthcare is complex business, though, and the environment in which AI is adopted is going to have a lot of other things going on. There's a regulation of the software, there's a provider, but you should have a really solid clinical governance kind of mechanism in place, and that's usually a clinician that's taken a lead role around having deep subject matter knowledge in the technology or the treatment or whatever is being deployed, so that then they make decisions around procurement, they make decisions and input into the training of their colleagues around the deployment of that tool. They're there and responsible for the troubleshooting if something goes wrong. So it's essentially there's two levels of skills you need to have. You need people to be a competent user. They need other leaders to emerge that have got deeper subject matter expertise that can lead that adoption across that service or across the healthcare sector.
Yeah, and I think about not to draw on the analogy too much further, but I guess in the event I was to get into an accident in the vehicle, then there was a failure with the vehicle. There's a whole point of like who's at fault with that particular thing. Often that then comes back to me as an individual, unless there's a lot of time that we've had to be able to work out what happens in those instances. But I guess when as you point out, there's a lot more complexity in healthcare that a lot of that's that unique nature of healthcare, in that the clinician as an individual often bears a lot of that all of the responsibility in terms of the patient care side of things. Is kind of the direction we're going, Sandra? This nuance and
Yes.
complexity we need to work out?
Yeah, I think you've hit the nail on the head, and Mark's outlined it very beautifully there, that it's about not only the individual doctor recognizing their own duty of care, not doing any harm, it's also that individual doctor maintaining their own education as far as they can and learning alongside their other colleagues. And the beauty is that our colleges are teaching AI now. People are taking this very seriously. Digital health technology is being taught to doctors even as I speak. And so there's a very serious attitude to this technology, although some people will say, oh, we don't want this, we don't really want this. But I don't think we can go back. I really don't. I think this is gaining its own momentum. And of course, it's going to benefit us enormously in terms of science, and not only diagnosis, but disease control and cancer treatment, etc. So it's enormous benefit to us. But what is important, as Mark has said, is having guardrails in place. And I think if you look at our last paper, what I really like about that, Mark, what we thought about was the concept of guardrails at different levels. Yes, you have the kind of governmental guardrail of the TGA not bringing a product to market unless it's been assessed for safety. Then you've got the next level of clinicians, high-level expert clinicians looking at the issue and trying to address it in more detail to clarify safety and so on. Then you've got the next level, which is the clinician face-to-face with the patient, taking the duty of care of explaining, as far as they know, that we are using the system within our practice. And then you've got the next level, which I like too, is that you get the informer. That is, by that I mean the consumer, who gives us information, who feeds back and says, you know, doc, I don't like this. I don't like you digging into my private data, or whatever the case may be. In other words, the patient, the community, are as important in this entire process, I believe. And I think that feedback, when we get feedback, we can also then mitigate against risk in terms of people will tell us, this went wrong when I did that, doc, and so on and so forth. So that kind of feedback helps to build the pillars of safety for use in medicine. And that's really, as Mark and I have said, it's a holistic approach to regulation. It's not just one thing, it's a number of steps down the way, and the patient, the community plays a role as well.
I like that we've all got a role to play in how the kind of future looks for the guardrails of these types of emerging technologies. And that's clear. If I was a clinician reflecting on this discussion, it's there's that responsibility that I've got of like, well, I need to lean in and understand these tools, and it's probably not going away. So I need to understand my role in that. And there's probably then the other side of like looking at what's next as well, not just those using it, but then also, what's the future for it. I guess, we do have guardrails right now, Mark, in terms of the regulatory landscape and the TGA, and then globally there's all the other ones as well. And I guess if something was to be regulated right now today, a tool, then it's going to be using the current infrastructure we have. So is there a role at the regulator side that, because the risk that we run sometimes with a holistic approach and a multifaceted requirement is that sometimes there's not a great deal of ownership, or like, well, what do I do with that information then? Like, who kind of runs with this next? And is there a role for regulatory to play in kind of shaping what this looks like?
That's also a great question. Maybe just to start with the liability dimension we were just discussing. Like, I think the College of Radiologists has some excellent standards around this that have also been repurposed for use in the pathology sector. So one of the key points that they raise is that from a governance perspective, you need to think about the liability in advance of deploying it, because healthcare is complex business, as we've been discussing. There are multiple different actors involved in service delivery, but in the context of AI, there's a public or private hospital or private practice environment, the business environment that the service is being deployed. There's the whole workforce, which is generally like a team of people. You might have somebody in charge of clinical governance, then somebody else who's doing the frontline clinical care. But there's also the supplier of the medical device software. And there are precedents in healthcare that we can look at here in respect of liability. So in the supply of medical devices previously for like some implants, so some like hip implants have had to be recalled in the past. There's also a duty and an onus, like an established kind of precedent for the suppliers of technologies also have duties around those. So the TGA is looking at their guidelines around this. And look, the area is not simple, particularly when you come to the more contemporary, like dynamic learning on the when they're after they've been deployed technology. So that's not an easy question. But when somebody goes through a regulatory approval process for the technology, there's like a series of things that they have to like demonstrate around the evidence that it's safe, the benefits of using the technology outweigh the risks of that. They've got post-market surveillance duties as well. So there's already a well-established kind of framework in respect of regulation we'll build upon as these new technologies that come to market, particularly those, the agentic ones that are, again, going to be another game changer around this. But we need to take a step back and think in advance of deploying this technology. Each party needs to know who's responsible for what piece and have that all documented from a clinical governance perspective, so that if something does go awry, then you've got already a basis to have that conversation. I know you're responsible for that component, we're responsible for this component, and you don't just wait until after the car crash to try to unpack what went wrong.
Yeah, 100%. And it's a good reminder that, you know, like you say, that if there's an implant or if there's a device that goes, it's kind of, it was put in a box, and when it was in the box, it was good, and then it goes into the patient, it's still the same thing that goes in, so you can regulate that thing at a point in time. But, you know, an algorithm, it was in a really good mood today, and all with the everything moving around in the afternoon, it decided to do something different. But I guess humans are unpredictable in that sense too, so that's something to reflect on in and of itself. But so definitely strong need for those different players in that holistic approach to work together, and we're all playing a part. What does that look like to you, Sandra, in terms of what this need for interdisciplinary collaboration looks like when you got your clinicians and the regulators and the technologists, and they're all kind of coming together to make AI more safe and useful? What does that coming together actually look like? What do we need to do?
Well, I think that's challenging, actually, because I must say, I've never spent much time talking to engineers or digital health scientists. Why would I? You know, I'd rather chat to a doctor about what I'm doing in my clinical practice. However, the field has changed, and I think now we are talking to engineers and software designers and asking, well, how the hell does this work? Tell me more about this data. How does the process of the algorithm work, etc., etc. So what I find actually quite beautiful, if I may say this, is that my own learning and my own experience of just humanity and intelligence, if you like, has expanded, in that I'm observing people that are extremely talented in their specific fields, be it engineering, data science, etc. I've talked to lots of people now, our CSIRO, TGA, etc. We've got a lot of talent in Australia, I might tell you. And yes, I'm connected to a lot of people abroad as well, where, again, the beauty that I'm seeing is people are willing to share knowledge at a scientific level, at a practical level. People are not being protective about their knowledge because they can see that this is a huge thing for humanity, and it's not human, you know. It's machine processing, so that humanity at large has to work together in order to get the best benefit that we can. So it is challenging, the issue of collaboration, but I personally love it. I love connecting with people that are doing things other than what I have done. And in so doing, I'm learning heaps. I'm learning stuff and feeling very much like a kindergarten kid. You know, it's quite exciting because you learn about stuff and you think, really, can it do that? Oh, yes, it can. Okay, so the idea then, the central concept to me is to keep an open mind, to keep learning, and to be open to attending, if you like, other types of, be they conferences or events or seminars where you can learn from people, that is, learn me as a doctor, learn from people that are doing things other than medicine, so that I can understand this AI technology in more detail. And that's the side I find challenging. It's challenging, but it's exciting, can be done. But may I add, Peter, that a lot of this, for me, in my experience, has been self-driven. There's not been a pathway that I could follow which said, now you've got to do this, now you've got to learn that, now you've got to do that. But by pushing my way through, if you like, I feel I can now assist others that are walking slightly behind me, not in terms of intelligence at all, but in terms of experience. People who haven't walked that path of the technology field. How do we find our way? And I love sharing that kind of information with people. So yeah, a lot of doctors are now asking, look, how can I learn more about so-and-so? And I'm linking them into, Stanford University and Oxford University, the Turing Institute, etc., people in France. There is so much talent out there, Peter, and I'm sure you're pretty familiar with all of that. But I would not want us at any point to feel that we in Australia are behind. I'm so impressed by the work of my colleagues in this country. I really am.
Yeah, no, I like that thinking that, maybe we don't need such a predefined pathway and end kind of solution in mind when we start this process, because then that we end up with a lot of excuses not to do things and stagnation, and innovation's not going to wait. So yeah, starting with that conversation, as collaboration does start with a conversation, I've heard. So maybe that's the best way forward. Mark, any other final thoughts around how we kind of bring that ecosystem together and those next steps when regulators, clinicians, and technologists all play a part in this?
Yeah, I think it's important to reflect on the AI applications that have really taken off in healthcare are ones that are really helping to solve a real world clinical problem. And the really good suppliers of AI tools recognize that quite early, got clinicians involved early into the design, the training, the testing, etc. So that collaboration piece has been a recipe for success in that environment. So what Sandra described around her path into the AI and digital health space is the typical path that most of us in the digital health community have followed to get to where we are today. But I think just being open-minded, focusing on teamwork, and teamwork's really, really essential in AI adoption, that clinical, the technical, informatics perspective, the governance perspective, the consumer role and input into all of that's really, really important for a team to come together to really face up into how we're going to make the most of this opportunity that AI brings, and then manage any associated risks in a way that's just sensible and grown up.
Yep, I like it a lot. Look, we'll in the show notes of this episode, we'll make sure that paper that's I believe in the Journal of Medicine and Law around applying duties to oversee AI to medical practitioners in Australia is linked up, so people can dive into that if needed, but also connect with you both. And I'm sure we'll hear and see more of it out on the expo floor and in the plenaries and stuff over the coming months and years, because it's a topic front of mind for all of that ecosystem. So Mark, Sandra, we're going to have to leave it there. Thank you so much for your time.
Thank you.
Thank you very much. Bye-bye.
We hope you enjoyed this episode of Talking Health Tech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.